Urologic cancers explained from first symptom to complete treatment. Most men and women are surprised to learn how many cancers start in the urinary system. Kidney, bladder, prostate, ureter, adrenal, testicular, penile cancers all begin quietly. And because they are silent at first, most people miss the early signs. I am Dr. Shrikant Atluri, uro-oncologist and robotic surgeon. In this video, I want to give you a complete, clear, beginning to end journey how urologic cancers are detected, diagnosed, staged, treated and monitored. Let us begin at the very beginning, early symptoms. The most important red flag is blood in urine. This could be bright red, pink or tea colored. It can happen only once and disappear. It may or may not cause pain. This single symptom is responsible for detecting a large percentage of urinary cancers, especially kidney cancers and bladder cancers. Other warning signs include a dull ache on one side, persistent back pain not linked to muscles, weak urinary flow, burning that doesn't settle, or waking up many times at night. Testicular cancers show up as a painless lumps. Prostate cancers show up as urinary changes, but often very late. Once a symptom appears, the first step is evaluation. We start with simple tests, a urine routine, urine culture, and a kidney function test. These tell us if blood, protein, infection, or abnormal cells are present. Next comes imaging. For many patients, an ultrasound is enough to identify whether the kidney or bladder looks abnormal. But ultrasound is only the first layer. To get clarity, we often need a CT scan or MRI. These scans show the size of the tumor, its location, boundaries, and whether it touches critical vessels or lymph nodes. For prostate cancer, an MRI gives us a very accurate picture of what is happening inside the gland. Once the scans point to something suspicious, we move to a biopsy. Biopsy strategies differ based on the organ. Testicular cancer is diagnosed with an ultrasound and blood markers. Bladder cancer is diagnosed during a cystoscopy, where we visually inspect the bladder with a thin camera and take tissue samples. Prostate cancer needs a targeted MRI-guided biopsies. Kidney cancer often does not need biopsy because the scans gives us a near perfect clarity. Once we have a diagnosis, we move to staging. Staging doesn't mean advanced cancer. It simply means categorizing the cancer based on the size, spread, and involvement of other cancers. This is critical because each stage has a different treatment path.